15% of all women in the U.S. are considered to be in fair to poor health. That's according to the CDC. Numbers that emphasize why prioritizing your health, both physical and mental, has never been more important. This is National Women's Health Week, a time to focus on encouraging women and girls to reflect on their individual health needs. The best ways to do that coming up now on the Morning Medical Update. Good morning. It is Thursday, May 12th. Thank you so much for joining us here on Facebook, YouTube, and on Twitter. In just about 15 minutes, swimming may be a fun exercise to do during the summer, but just doing laps may not be enough to keep you fit. We'll talk more about that. Coming up at 8:15, Dr. Dana Hawkinson joins us with the latest COVID-19 count, and we'll discuss today's top COVID headlines. But first, heart disease, cancer, COVID, the three diseases killing women, the other health issues they also face, and the best way to make sure they have access to the health care they need. Please get your questions sent in to us on YouTube, Facebook, and Twitter. Also, email us at the Medical News Network. You can find links to those right there on your screen. The numbers simply tell the story. According to the CDC, 42% of women over the age of 20 are considered obese. Only 49% of women meet the proper guidelines for aerobic activity. And the number of women with high blood pressure is 45%. National Women's Health Week is a chance to highlight the issues women face socially, economically, and physically. The goal? To encourage women to take control and improve their overall health. Joining us this morning is Dr. Kevin Ault, an obstetrician and gynecologist here at the health system, who's also a member of the CDC's Advisory Committee on Immunization Practices. Also, Dr. Melanie Meister. She is a urogynecologist, and Dr. Charla Smith, principal investigator and director of Kansas Birth Equity Network. Welcome to both of you. Also joining us virtually is Dr. Kelsey Ryan, clinical director of Women's Health and Family Medicine at Casey Care Health Center. So good morning to everyone. Lots to discuss, and we are looking forward to your insight and advice. National Women's Health Week starts each year on Mother's Day to encourage and remind women to make their health a priority. Doctors, we want to start with you and just talk in general how the pandemic affected women's health and their access to health care. Dr. Ault, I'll let you get us started today.
Well, you know, as I reflect back on the last 2 years, I just think, you know, the amount of stress that society and women in general are under is unprecedented. You know, we've had more deaths from this pandemic than any other pandemic in American history. We're going to be cross 1 million deaths sometime in the next week or two from COVID, you know, which is 1 out of every 300 Americans. You know, so there's lots of people grieving. There are a lot of people having stress, and certainly that falls on women disproportionately. Like other pandemics we've had, this pandemic has affected pregnant women, and we can certainly talk about those issues as well. So,
Dr. Ryan, good morning to you. What are you noticing? What are you hearing in the community for those that you serve as far as COVID and the effects it had?
Yeah, absolutely. You know, a lot of my patients are coming in for common issues that women see: abnormal bleeding, pelvic pain, but you know, during the pandemic, many of them were home caring for their families, children, feeling very isolated. And I think for a lot of them, it was easy to move their own health lower on the priority list. And because of that, maybe they didn't make it in for their visits, or they didn't pick up their medications from the pharmacy when refills were up. And I see a lot of my patients, their own physical and mental health is suffering because of that. And, you know, we do see women tend to suffer disproportionately in situations like this because we tend to be caregivers and providers and put others' needs above our own. And I'm certainly seeing that in my own patients.
Dr. Ryan, for those who may not know, what does Casey Care do in the Kansas City community?
Yeah, we're a community health center, so we provide health care to anybody who walks through our door that may be uninsured or insured patients, but we don't decline services based on inability to pay. So we do primary care services, but we also have dental and mental behavioral health services all wrapped under the same roof. So patients can come in and access any of those. And we have a pretty robust HIV treatment and prevention program as well.
Dr. Meister, what type of after effects are you seeing with patients, and what are you just hearing among colleagues when it comes to post-COVID issues, and what are you seeing in your practice?
So really what we're seeing is women who are re-entering care, women who may have been suffering with symptoms of pelvic floor disorders, which is largely what I treat, but other medical conditions, and they largely were absent from care for most of the pandemic, but now that things are opening back up, they are re-entering care and wanting to have these symptoms addressed.
Dr. Charlotte Smith, again, Principal Investigator and Director of Kansas Birth Equity Network. I want to just talk to you about what are some of your biggest concerns? What have you seen? What concerns you most moving forward? Has anything gotten better since the beginning of the pandemic?
Yeah, so I think with our work, we really focus on Black maternal health, and what we saw was nothing really truly different from what we saw in the beginning. Black women have been disproportionately affected by these outcomes for centuries, and so we saw that exacerbated during COVID, and I think what Dr. Alt said about having more stress, we saw that as well. But we also saw, according to the CDC, 2 out of 3 women are caregivers, and during this pandemic, women were at home, they were trying to juggle working and homeschooling and all of their issues, and so they were, of course, missing their doctor's appointments or any health appointments to take care of themselves because of the role of being a caregiver. And so we see now that as women are trying to re-enter the health system, that we're seeing those disparities are worse. And we see that there's still some issues with trying to juggle home and work, and also grieving from those that have lost, and also the reality of having limited access to prenatal care or limited access to quality prenatal care. So we still see those issues in place today.
I want to ask Dr. Ryan, how are you helping people find those resources, especially when people lack the insurance and lack the know-how on where to go and where to start when it comes to putting their care first, especially with women and minorities?
Yeah, it's a great question. We tend to get pretty creative about how to access services when a patient is having difficulty with that. So we do utilize some charitable organizations. Kansas, for example, has one in Wyandotte County called WIJO Care. We have a lot of social workers and community health workers that also know of several services in the community that patients can access, and it even goes as far as lining up transportation for them or rides for them to get to their appointments. We use state programs that cover cervical cancer screening, breast cancer screening, so we really cast the net pretty far and wide when it comes to accessing help that patients need to get the services they need.
I want to talk about a topic that is hitting the headlines really anywhere where you wake up this morning, which is the formula shortage across our country. It's very concerning and not a lot of answers right now to it. Dr. Smith, I want to bring you in because you say breastfeeding, which is where women are going to have to turn to. And Dr. Alt, I want to talk a little bit more about that here in just a moment with you. But talk about the limited resources there, and limited already, and now they're going to need it now more than ever when you have a crisis like this. What is your insight and your thoughts?
So there are disparities in breastfeeding. Black women are less likely to breastfeed and to uptake breastfeeding for up to 6 months, which is kind of that requirement. But we saw before the pandemic the disparities in getting help, assistance when trying to breastfeed and getting support. And so we'll see that going forward. There's still issues around getting support in breastfeeding, and the support from the hospital or the lactation consultants within the hospital to help these women breastfeed if they have any problems. And so we saw a lot of our women seek additional support from Facebook groups and from other outside organizations just to get that help. But I think it's very important that as we move forward to this shortage, that we provide additional support for Black women to breastfeed regardless of whether we feel they should breastfeed or not. Like, we should just provide that support and allow them to breastfeed, and also encourage them to breastfeed for a 6-month duration and provide support from doulas or lactation consultants to really help them succeed in that.
We have an entire show tomorrow dedicated to this topic, and experts specifically who will give their expert opinions. But Dr. Alt, I have to ask you, what kind of advice would you give to women, and how has the breastfeeding conversation come up with your patients?
Well, I think we're fortunate that at KU and most of the other hospitals in the region, we have lactation consultants that see patients within the first day of life. And so there's plenty of support in that short term, a few days you're in the hospital after you deliver. But as Dr. Smith said, we need longer term plans after you leave the hospital for those first few months from doulas and lactation consultants. So we need to call on all those resources.
Absolutely.
Is what we need. So.
All right, so I want to talk about women's issues. Dr. Meister, I'm going to bring you in right before the show. We were talking about, the big M word, menopause. What is new with that? Please say it just magically went away. I told you I found myself Googling it quite often these days, wondering if anything and everything that's happened to me has to do with that. I will just come on out and admit it. So talk to us about what women are talking to you about. That's still a hot topic, no pun intended. Tell us more.
It is still a hot topic. Unfortunately, no, it has not gone away. But certainly we're learning more about the symptoms of menopause and how variable they really truly can be. Some women experience absolutely nothing before and around the stop of their menstrual period. Other women have symptoms that begin several years before their periods stop and continue on even a couple of years afterwards. We're learning more, as I said, about ways that we can treat this, both with medications and hormone use, but other non-hormonal methods as well. I think it's something that women have historically been reluctant to talk to their doctors about, but now I would really encourage women to reach out, even if they aren't sure, as you suggested, if symptoms are related to menopause. It's certainly something to open the door. And here at KU, we have a lot of physicians, both within OBGYN, but other specialties as well, who are experienced in caring for women with menopause, and or certainly could get you to someone who is.
All right, let's talk about the pelvic floor, the dreaded pelvic floor and the weakened bladder muscles. Tell us what that is, what that causes. Dive in and explain.
Sure. So when we talk about pelvic floor disorders, it's really an umbrella term that encompasses everything from pelvic organ prolapse, which is where the walls of the vagina or the uterus descend and in some women actually bulge to or outside of the vaginal opening. It also includes urinary symptoms, urinary urgency, frequency, leaking urine, and some bowel symptoms, leaking stool or leaking gas when you're not intending to. And these pelvic floor disorder symptoms are actually very common, although again, largely undiscussed among women and their providers. But we know that about 1 in 4 women experience at least one pelvic floor disorder sometime in their life, and many women experience more than one. They're symptoms that we can treat conservatively or in some cases with surgery. But like I said, there are a lot of options to help women who are suffering with these conditions.
I want to ask a community question from Amber. She's asking, is pregnancy the only thing that causes pelvic floor disorder, or is that the main source of it?
It's a very common source or a common cause, but there are a lot of things that can contribute to the development of pelvic floor disorder symptoms as well. Age, unfortunately, menopause, as we were just talking, both of those increase the risk of the development of a pelvic floor disorder symptom. Other things too, though, obesity is a common contributing factor, as well as other conditions that increase straining or increase the load that the pelvic floor has to bear, like chronic coughing from COPD and other medical conditions like that.
Okay, I have to just ask, is this what causes you to pee a little? Just say
yes.
it. I mean,
yes.
So
urinary incontinence or leaking urine is a very common symptom. It's one of the most common pelvic floor disorder symptoms, and urinary incontinence or leaking urine or peeing a little bit and can really affect women in a variety of situations. For many women, especially many women after they've had pregnancies and deliveries, it's leaking a little bit with coughing, laughing, sneezing, running, jumping, bending, lifting. I have women who come in and tell me, I can't jump on the trampoline with my kids anymore because I know I leak a little bit. But other women don't have as much leakage with those activities, but do suffer from urinary urgency, the sudden feeling that they have to go to the bathroom and they can't hold it, or they get to the bathroom and they just can't quite get undressed in time before they start to leak. And really all of those symptoms are things that we can address.
Of course, I was asking for a friend. It's just, thank you for answering that for, her. Okay, well, what a perfect time then to just transition over and talk to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning to you. How's the COVID count looking?
It's good. I think from now on we can use micturate or urinate.
Okay.
So that's what doctors
Oh,
will
is
use.
that
So
the medical term?
We'll do a little bit of
Okay.
vocabulary learning for our audience too.
Urinate, not pee a little.
Right.
Okay, gotcha.
Sounds good.
Thank you for the medical terms. Trying to keep it real. All right.
It's a learning show
is.
here. The active infections are still doing pretty good. 5 active infections, 0 in the ICU, 0 on the ventilator, 9 in that recovery period. Holding steady here, luckily, although we've talked about this, gradual increase in overall cases. How accurate is that? Because people are probably not testing or testing at home. But really just a gradual increase in the hospitalizations, which is good. And I think the deaths over the 7-day average are still on the downtrend. So overall, trends are very good. Remains important to continue to be up to date with vaccine boosters and just keep yourself healthy.
Okay, couple of questions, COVID headline questions. Growing number of COVID-19 deaths are among vaccinated people, but booster shots substantially lower the risk.
Yeah.
Kind of explain that connection or disconnection, if you will.
You know, again, what we had always hoped for was that a majority of the people who come to the hospital or die are fully vaccinated. What does that mean? That means that the overall number of the people that are coming to the hospital or dying is greatly decreased from what it was in the pre-vaccine era and even when the vaccines were first rolled out. So that is a good thing. What we were looking for is the overall numbers, but we still understand that people are at risk of severe disease and hospitalization even with the boosters. You know, the best evidence that we have from Israel, South Africa, and here is that the vaccines continue to have great protection against hospitalization, death, over 80%, over 90%. So those are all good things, but there still are those individuals who, for one reason or another, especially if they're of older age and have comorbidities, will be at risk of those severe outcomes.
Question about congressional report finds that 400 million COVID-19 vaccine doses dumped by a Baltimore plant. Do you know why that was?
You know, I haven't seen the exact reason why that is. We know that overall we continue to, in general, during the days, have wasting of vaccine doses because they've been drawn up to give to people. We know that with the vials, you have to open them up and they're only good for a certain amount of time. We aren't getting as many as we would like into arms, but I can take a look at the exact
All right,
reason for
circle
the
back with you later.
Yeah,
Thank you. And what
sounds
were
good.
those 2 words you said? What was
So it's micturate or urinate.
micturate.
Micturate.
Okay, I'll never remember that.
Pee a little is
Urinate.
better.
Pee a little is better.
Pee a
Dr.
little
Smith
is
said
better.
I
she's-
mean, if you're out with your friends, I guess you can say pee a little.
Okay,
but
but Dr. Smith said
we'll keep the
I'm
learning
right on
going
track.
here on the show.
Exactly. All right, thank you for the backing. Okay, so we are back. We're talking about Women's Health Week today, so I want to get back to our topic because we've got a great panel today, and I want to get to some questions. I want to talk about prioritizing mental health, and Dr. Ryan, I'll start with you. What kind of conversations, are you having with patients? They come in with maybe some physical issue. But I would imagine sometimes those conversations can turn to mental health. How are we making sure that is being addressed properly?
Yeah, I think one of the best services we can do for our patients is not treat them as a separate body and mind, but treat them as a whole person. So we are very fortunate here that we have behavioral health services on site. So we screen every patient with a screening tool for symptoms of depression and anxiety. And if they do screen high, we can have them meet that same day with a behavioral health counselor and even get plugged into ongoing therapy services. But it's absolutely something that's very common in most of our patients and has definitely been exacerbated by COVID.
Dr. Smith, thoughts on mental health? And then I want to get your thoughts too, Dr. Alt, on how we're addressing that and just bringing that topic up, whether it's the main reason someone comes in or not.
So Black women are more likely to experience mental health or perinatal mental health during the time of pregnancy. And so we saw that exacerbated during COVID in the isolation of being alone at home and trying to, of course, juggle all of the things that pregnant women were doing. We're trying to bring awareness of that through our Kansas Birth Equity Network and partnering with organizations that work on this in the community, and also to increase the awareness of the resources that are available to women, particularly Black women around this area. We still see that mistrust. So while there are services available, it still is not normalized within the Black community. There's still a lot of distrust in seeking mental health, or there's a stigma tied to mental health. And so we really are working hard within our community to dismantle that stigma so that Black women will seek care. But we see this being exacerbated, but we also see those factors that were prior to COVID still in place. And so we really have to work hard to normalize mental health care.
Yeah, Dr. Alt, how are we changing the conversation about mental health issues just over time, from maybe where they didn't want to be talked about, they're shoved under the rug, to now are we feeling more comfortable talking to women about that and addressing that and making sure they get the resources?
I mean, something that you can do if you're a provider or a medical facility is to screen people. There are validated screening tests that are just a few questions for women who are just there for routine care, or pregnant women or postpartum women, and get them into care. I think if you start doing that kind of screening, especially during a pandemic, you're going to find, you're going to ask questions and get answers. And the answer you're going to get, I think, frequently is there's plenty of anxiety and depression out there. And the other thing that I usually talk to patients when they have those positive screens is that, you don't have to see a psychiatrist. You can see a psychologist, you can see a social worker, maybe you're a priest or you're a minister. You might have some resources more locally that you can rely on, because if anything, the last 2 years have shown us there's plenty of suffering out there, and we need to rely on those kind of resources.
I can't imagine going through a pregnancy, going through having a baby during a pandemic with everything else that's going on around you. Dr. Ott, you just got back from OCOG in California. What is that, first of all?
So that's the American College of Obstetricians and Gynecologists.
What'd you learn? What'd you come back with?
Our first in-person meeting in 3 years. So, I mean, there was lots of stuff to talk about. It was very heavily attended. The meetings in California frequently are, but even more because we haven't met in 3 years. I mean, because of my own interest, I thought it says something that the American College of OBGYN, the very first podcast that they've ever done is going to be about maternal immunization, and that's a direct response to COVID, and it's available on the ACOG website. It's meant to go out to patients, because we've known for more than a century that respiratory pandemic viruses are bad for pregnancy, bad for pregnant women. We're going to see about a 20 to 30% increase in the number of maternal deaths in the United States in 2021 because of COVID. And we already have a horrendous problem with maternal mortality in the United States, but there's plenty of other information about the unique effect of COVID during pregnancy, because it looks like the COVID virus infects the placenta and causes things that are common anyway in pregnancy to become more common, like toxemia or preeclampsia and stillbirth and that type of thing. And then just in the past few days, since I got back from ACOG, there's been a publication that makes it look like vaccination protects against some of those pregnancy complications. So even in just 2 years, we've kind of fit all that data together, and appropriately, the American College of Obstetricians and Gynecologists is one of a number of women's health organizations that's leading the charge for more immunizations.
I've got a few more questions, but I'd like to intertwine those with some community questions that we're getting right now, if we can start with those. Emily wants to know, when do we typically start bone density screenings? Does my PCP follow this? Dr. Meister, what are your thoughts on that? What advice?
So typically we start bone density screening at the age of 65, unless there are some risk factors that would increase a patient's risk of having a lower bone mineral density earlier. And that those conditions are often related to medications used, or potentially family history or personal medical history. And those are things that you can talk to your primary doctor about, or if you see an OBGYN regularly for your annual exams, that person can also speak to those.
And Emily just wants to know, overall, what should we be thinking about when we think of bone health? Are we talking about certain foods we eat, supplements we take? You mentioned the screenings. What else? What should we consider?
So certainly calcium and vitamin D intake are important, as those help support bone health, but also exercise and weight-bearing exercise and general physical activity in general can be really helpful to promote bone health and increase longevity.
Question from Jeannie. Thoughts on the need for regular PAPs, Dr. Alt, in women over 65 that had a hysterectomy many years before?
So a pap smear is a screening test for cervical cancer, and most of the time in the United States, when we do a hysterectomy, we remove the cervix. And so you're not at risk for cervical cancer if you don't have a cervix, of course. So vaginal cancer is exceedingly rare, and so we don't really recommend pap smears to find vaginal cancers, except in women who've had cervical cancer before. It's probably the biggest risk factor for vaginal cancer. So you, as a rule of thumb, you don't need a pap smear after hysterectomy. Of course, you need to talk to your doctor about that. So.
Dr. Meister, Angie wants to know, we talked about pelvic floor issues. What are treatments for that? And how do you know if you need to see a doctor?
Well, I would say you need to see a doctor if you're bothered by your symptoms. And I tell a lot of women think, you know, it's common. I talk to my friends, everybody leaks a little bit. And what I tell women is, even though it's common, it doesn't mean it's normal, and it doesn't mean it's something that you have to deal with. And if it bothers you, that would be a reason enough to see a doctor. And if your doctor thinks you need to see a subspecialist, then they can get you to one of us. Really, treatment options span the full breadth, from conservative therapies like lifestyle modifications that we can make, working with a pelvic floor physical therapist or doing some pelvic floor exercises. Sometimes there are medications that we can use, all the way up to surgery. And there are surgical interventions that are very helpful for some of these symptoms and lead to really an improved quality of life for women.
Dr. Ryan, Jenny wants to know, what are just some overall healthy behaviors that they can just start doing? If maybe they've had a diagnosis recently or starting to not feel like themselves, what advice would you give them on kind of where to start if maybe they haven't been doing all the things they've been doing, but it's never too late to start? So where would you direct them, or what advice would you have?
That's a great question. And my answer may come as no surprise, but really eating a healthy diet, eating food that really nourishes your body goes a long way. I often tell my patients that food is one of the best medicine, maybe the best medicine out there. And I do acknowledge that for some people, there's a real disparity in access to healthy food, and that may not always be easily or readily available. But as much as possible, choosing healthy foods and getting outside, moving your body every day. It doesn't have to be intense physical exercise, but walking every day, getting outside, so good for your overall health. And the last thing I would put on that list is getting regular sleep, 7 or 8 hours a night. And may not be full 8 hours every night, but getting regular sleep really goes a long way for your health as well in the long term.
Shirley has a question. Are there hormones in Fosamax or Bonita, which I know people take for calcium and strong bones? Who wants to grab that one?
I hope we all would give the same answer to that.
Okay.
I would say no. This would be the answer to that. So,
and when somebody's asking if there are hormones, why would they be asking? Because they don't want them, or they do want them?
well, one of the things, this is kind of come and gone as far as a treatment for osteoporosis, but one of the things that we did maybe 10 and 15 years ago is put people on postmenopausal estrogen replacement to preserve their bone health. But now we have a lot more options. Maybe Dr. Ryan could talk about those. But now we have a lot more options, for treatment. I mean, it's almost overwhelming how many options we have compared to 10 or 15 years ago for osteoporosis. So,
anything you can add to that, Dr. Ryan?
Not much really. Just, we have non-hormonal treatments we can use for a few years to support bone health and try to prevent further bone loss and maybe even some rebuilding. And those have a much safer medication profile than some of the hormonal treatments.
I think maybe the other thing to say is there's probably not a one-size-fits-all approach to osteoporosis because there's so many options. So
got it. Okay, so Dr. Meister, I have to ask you that about like hormone replacement. Do you get questions about that? Where do people start with that? I would imagine that's not a one-size-fits-all either.
No, it's not a one-size-fits-all. Yes, I see. I get a lot of questions about hormone replacement therapy, as I'm sure everybody on this panel probably does. Generally, when we talk about hormone replacement therapy, it is an option for treatment of menopausal symptoms. Usually we think about that being most effective and most useful in the early time around menopause, so around the time that periods are stopping. And we don't generally want to continue it for years and years after the menopausal transition, but it can be helpful early on to help with symptoms.
All right, let me make sure I've got all my questions because I do have one for Dr. Hawkinson. Well, actually, Fanny wants to know, do you know about the urine wick machine to prevent UTI? No clue what that is. Who wants to grab that?
Dr. Hawkinson is shaking his head, so maybe he knows something about it.
Do you know something we don't?
Yeah, so when you come into the hospital, or if you're not urinating correctly, you do get devices to help you. So most of the time, historically, they have been indwelling Foley catheters that go into your bladder so that you don't have to worry about that. It's just drained straight from your bladder into a bag to help you urinate and release that pressure on the bladder. There are external catheters that have been used previously. One of these new methods is, instead of putting the Foley catheter into your urethra, they have this external wicking catheter. It is hoped to help reduce UTIs, but what we found in the past with other types of external catheters, you still remain at risk of urinary tract infections as well. And so anytime you have a prosthetic device or a hardware or a foreign body, either in your body or something like that, an external, you still are at risk, but hopefully you can reduce that risk of getting that urinary tract infection with that. So.
Thank you for that. A couple quick questions, and we're going to get to some final thoughts. But Sharon wants to know, Dr. Alt, so do women over 65 who had cervical cancer still need to do regular pap smears?
Yes, there's some guidance about getting regular screening if you haven't been adequately screened, if you have precancerous changes or cervical cancer for years afterwards. And so, that's not a majority of women over 65, but it's certainly a fair number of them. And so, off the top of my head, I think it might be 25 years, but it's a long time. So, in any case, I would have to fact check myself before I committed to 25 years, but it's a long time after you've been treated or had an abnormality.
Okay. And just last question, Erica, speaking of UTIs, like what's actually happening with a UTI? What causes them, and are women more apt to get them? Dr. Meister?
Yeah, so we see and treat a fair number of recurrent UTIs or urinary tract infections, and that's really what UTI stands for, urinary tract infection. And by that term, it really encompasses infection anywhere in the urinary tract. Cystitis, or infection of the bladder, is most common, and that's what we think of when we think of strong urge, maybe pain with urination. But really, a UTI could also ascend and affect the kidneys, which is also called pyelonephritis. UTIs are very common in women, and they're common in women actually as we get older too. And postmenopausal women are disproportionately affected actually. Some of the reason that UTIs are more common in women has to do with the anatomy. The female urethra is very short and in close proximity to the anus. But as we get older, and I mentioned they get more common as we age, the hormonal changes after menopause have to have an effect on the occurrence of a UTI and the persistence and recurrence as well.
All right, I just want to check real quick and make sure if we have any reporters on the line today. We good? Okay, Dr. Hawkinson, Samantha has a question. She wants to know if I could ask you if we should worry about Johnson County's positivity rate being over 14% again. What do you know about that, and any concerns?
Yeah, I mean, certainly we know the virus is circulating. We know cases are going up. I think there is a lot in there. I think you should always be concerned and really be able to protect yourself and make sure and understand that you are most protected from hospitalization, severe disease, and death. And that is, of course, vaccination, but also if you have symptoms, test early and get on Paxlovid. So what about the positivity rate? Well, again, positivity rates are based on numbers, the number of people who are coming to test, the number of positives in all of those people. And so we understand that there probably are people who aren't testing, who are testing at home. And so some of those numbers can be skewed. That positivity rate can be skewed just based on the numbers itself. But I think overall, if you're looking at the number of people who are going to be tested, that is certainly a concern. We have to believe that the number of cases that are diagnosed are going up. But again, it's important to, if you develop symptoms, get tested early so that you can get on Paxlovid, again, to help reduce your rate of hospitalization.
Well, we certainly can't talk about women's health without talking about young women and young girls' health. And so just my last question is to Dr. Ryan and Dr. Smith. And Dr. Smith, I'll let you get started. Just what kind of messaging do we give to young girls to make sure that they're not going down this path, and that they're making sure to put their health first, and that they're making sure to reach out and ask questions and get to the resources that are available to them? How do we start people out young?
We can start by having conversations. So we know young adults like to have conversations, and particularly those on social media, so reaching them where they are. And then the other thing is we like to present everyone with the data, and I think that's great. But we also need to talk about how they're thriving. How can you thrive? How can we be positive in our messages and point them to the resources that are needed so that they can take care of their health, and also talk about the longevity of this. What do you do if you eat right, if you exercise, if you don't smoke, if you go to your doctor's appointments, if you take care of your mental health? We need them to know, because there are so many young people suffering from mental health disease. We need them to know that mental health is mental wealth, right? It lasts for a long time if you take care of it, and it's okay to seek help. If you need it, it's okay to ask your doctor, but the most important things is reaching them where they are and providing them with the necessary data, the necessary information to thrive, and also with the necessary resources that they need to be healthy.
Dr. Ryan, anything to add to that about how we reach those young girls?
Yeah, absolutely agree with that. And to that, I would add modeling by moms and adult female role models. When children see us taking care of ourselves, taking care of our own mental health, prioritizing those things, it normalizes it for all of them. And when they're adults, I think it increases the chances that they'll have those same priorities and make those same choices.
I want to get to our final thoughts. And Dr. Ryan, I'm just going to stay with you. What would you like us to know in closing today?
I have this conversation over and over with my patients, and I often wish that there were better public service announcements about this, but a lot of my patients think that their pap smear is a sexually transmitted infection screening test, and that can be included with the pap smear, but your pap smear is your cervical cancer screening test. And if you're an adult woman at over 21, it should be done every 3 to 5 years, unless you've had an abnormal test in the past, maybe more frequently. And the amazing thing about cervical cancer screening is when we do it at the appropriate intervals, we can actually prevent cervical cancer. So come in for your pap smear. We can prevent cervical cancer years before it ever happens. And it's just an amazing thing we can do here in our healthcare system.
Great reminder. And thank you so much for being with us today. Dr. Meister, your final thoughts.
I would say I'd just like everyone to remember that although pelvic floor disorder symptoms are common, they don't have to be something that you live with. And we have both surgical and non-surgical ways of addressing those. And I would really encourage women to reach out and talk about these symptoms with their doctors so we can get you on the path to wellness.
Thanks for joining the panel today. Dr. Smith, thank you as well. Final thoughts for our audience.
I think my final thought would be, as we listen and think about the disparities that are out there, to start to listen to women, to let them know that they're a part of this conversation and having a shared decision making for their health, and to also support women, like trust women, because we know that they need these help, but also that women do go to their doctor's appointment, do exercise, do eat right, and that also we provide resources that are needed so these women can seek the care that they need, and also increase the diversity of our workforce, increase the diversity of our student body, so that women start to see women that look like them in the healthcare system. I think that KU is doing a great job at that, but let's continue to do the work, and also remember that we should trust women, we should listen to them, and we should make it easy for them to seek the services and resources needed.
Thank you for being with us today. Dr. Alt, before we started the show, I said, what are a couple of disparities that we could talk about when it comes to women? And you kind of looked at me like, a couple? There's a couple dozen. Yeah. So, which is why you're here with us today. Just what do you want us to know? Anything I haven't asked you that you just really want to make sure we get the message out about women taking care of themselves and each other?
Well, I mean, since I just got back from our national meeting, I've been thinking more about pregnancy planning. And so we started by talking about, underlying health, certainly going to see somebody like Dr. Ryan or somebody that's involved in primary care, including OBGYNs in our community, to plan your pregnancy helps things along. And so hope that goes without saying, but since it's final thoughts, that's probably a good place for me to end.
All right. Well, we will see you back here again. I know you've got some meetings coming up, so we're going to want to hear back from you here in the summer. So thank you so much for being with us. Dr. Hawkinson.
Yeah.
Thank you for the message you just sent me, by the way. It says, I wish I could show it to everybody. It says, with age comes skill. I can laugh, cough, sneeze, and pee all at the same time. It's called multitasking.
Yeah.
And so, yes, I think we can joke about it. I know it's a real thing, but sometimes you just kind of have to go, yeah, I guess this is the new me. So anyway, thank you. So what kind of magical insight can you leave us with today?
You know, a couple things. So first of all, the vaccine that were wasted. You know, we know that plant in Baltimore has had problems before. We have seen that. This is a continuation of that. But again, I think we need to focus on what is important about that. The FDA continues to be alert and really watching for the safety of these vaccines, watching even the production process. No corners have been cut. The vaccines continue to be safe, and even the manufacturing continues to be monitored. So I think that's very important. You know, we heard from our guest about cancer screening with the pap smear and HPV. I think it's extremely important. Even though younger people are more healthy, have less risk of cancers, it is important to do that early cancer screening, especially for women. You know, having that regular pap smear is important. In my practice, I see a lot of HIV positive men or men who have sex with men. We even do anal pap smears on them to look for anal cancer as well. So cancer screening is extremely important. And leading into that is there is a vaccine, a very good vaccine to help protect young people from anal or rectal cancer and cervical cancer. So please, parents, get your children vaccinated with the HPV vaccine. Children as young as 9 years old can start that vaccine series, and after 15 you can have a catch-up series as well. So please talk to your physicians, get them vaccinated against HPV. And the last thing, I would like to wish happy birthday to my sister. She's been recognized a lot recently with Nurses Week. She is a nurse. Also with Mother's Day, she is a mother of 3 beautiful children there. So she continues to be a very good, hardworking nurse, mother, doing everything at the house. So happy birthday to you, and you know, stay well.
Stay well. Happy birthday, Amy.
Yeah.
All right. Thanks so much for those good reminders about the vaccines. That's how you start them out young. All right. In headlines this morning, as temps rise, it may have you taking a dip in the pool. Many folks swim laps or find other ways to exercise in the water to stay healthy and cool. Orthopedist Dr. Kim Templeton explains why you may need to do a little bit more than just be in the pool to stay fit this summer.
Swimming is a great exercise, and we try to recommend that people engage in whatever exercise they're physically capable of doing as much as possible. It helps with muscle strengthening, it helps with cardiovascular conditioning, and so if your exercise of choice is getting into a pool and swimming, that's great, and it's especially good for people that have painful joints. If they have arthritis, the water helps support your body weight. And so if you like swimming, if that's your preferred mode of exercise, that's great. That's going to keep you in good condition. If swimming's not your thing, but say biking is, that's fine too. It's just finding what works for you and what you're going to keep up with and what can hopefully keep you from avoiding injuries. And this is all to do with bone health. You achieve what's called peak bone mass sometime between the ages of 20 and 30. Between the ages of 30 and 40, the amount of bone that you have stays pretty stable, but then as you start to get older, whether you're a man or a woman, you do start to lose bone. You help maintain your bone strength, which you need to keep from breaking a bone when you fall, through diet, making sure you get enough calcium and vitamin D and enough calories, but also through exercise. Bone responds to weight-bearing exercise, so the more you're stressing your bone with exercise, the stronger the bone remains. So while swimming is good if you have painful joints because the water helps support your body, it's not as good for your bones because the water helps support your body, and so that's not a weight-bearing exercise. So I would say if people are using swimming as their primary mode of exercise, that's great, but also try to mix in some walking or using an arc trainer or anything where you can actually do some exercise where your body is resisting gravity.
Hey, coming up this morning at 10 on All Things Heart, did you know that your teeth play a huge role in your heart health? Alexis Del Cid shows us how the work of 2 doctors helped a man save his pearly whites.
It's very functional. There's also not a pickle jar in the world that I can't open.
Despite everything that life's thrown at Terry Vare, he's still a pretty good sport.
See, it's got a little charging port right here.
In 2007, a blood clot landed the Warrensburg man in the hospital where he had a stroke, followed by 5 surgeries.
The fourth surgery was when they amputated my hand. Fifth surgery, I was nearly healed up and they were fitting me for a prosthetic hand. And they discovered that I still had about an inch too long on my ulna. So they went back in and whacked another inch off.
But Terry got through it and went back to doing what he loves, teaching gardening to fourth graders. As the years went on, life was going relatively smoothly. Then 2020 hit, a doozy for all of us, but for Terry it also included rotator cuff surgery, followed by surgery to remove a growth on his prostate just 10 days later, and then in 2021...
And then I had my teeth removed.
All of them?
Yeah.
Yes, you heard that correctly. He had to have all his teeth removed. Teeth are living bones, and the blood supplied to those bones was so diminished from that blood clot in 2007, Terry's teeth had all started to die. Enter dentist Dr. Maria Berrigan.
What a sweetheart and what a great, great dentist. She just did a bang-up job.
But before the University of Kansas Health System dentist would even touch Terry's teeth, Dr. Berrigan needed to do something crucial that she often does with her dental patients: consult and work in tandem with their cardiologist. Because she says gum disease and other dental problems often go hand in hand with serious heart problems.
So how's Terry doing today? We'll talk with him and those two doctors who helped save his teeth. That's coming up at 10 a.m. on All Things Heart. And Dr. Hawkinson, you had something to add to this. What do you know about this?
I would encourage everybody to watch this show. Please get your dental health as well. I know we can keep harping on what you should be doing, to keep you healthy. I just had a gentleman in the hospital who came in with heart failure. He couldn't breathe. He came in with infection on his toe, bone infection. These were completely unrelated. They were not necessarily related to his teeth at all, but he had been trying to get his teeth extracted for more than a year. We know dental care is hard to come by for some. And when he left, we had his teeth extracted, and you know what he was most thankful for? Even though now he could breathe, his toe was better, he was most thankful for actually getting his teeth extracted because his mouth didn't hurt anymore and he could eat. So it's very important. A lot of people go through every day with those kinds of issues. So please encourage everybody to watch this show and try to seek out some dental care.
Interesting, because it's something we've heard of, but I don't think we realize how much, first of all, we take that for granted, dental care, but when people who can't get it, and then it affects really their body head to toe. So thank you for sharing that. And yes, we will be watching at 10 o'clock on All Things Heart, and we hope you join us. Thank you so much for being with us today. Don't forget, you can catch our shows anytime by logging onto Facebook, YouTube, and Twitter. Make it a great one. Coming up tomorrow, it's an alarming reality. Store shelves where baby formula once sat, now empty as the nation deals with a formula shortage. Now many parents are desperately turning to social media and online options to feed their babies. Experts weigh in on the pros and cons tomorrow at 8. And before we go, today marks the end of National Nurses Week, and two Kansas City Chiefs players want to send a special thank you to them. We will leave you with that this morning. Go out, make it a great day. We'll see you back here tomorrow at 8.
What's up, nurses of the University of Kansas Health System? It's Nick Bowden here with the Kansas City Chiefs, and I just want to wish you all a very happy Nurses Week. Without your hard work and dedication to keep Chiefs team safe, we wouldn't be able to do what we do on the field.
Yo, what's good, nurses of the University of Kansas Health System? This is McCole Hartman from the Kansas City Chiefs, and wait for it. I want to wish y'all a happy Nurses Week. Yes, sir, let's go. Are y'all excited for this? Happy Nurses Week, man. Let's get excited. Let's get very excited, man. But, yeah, on a serious note, we want to just thank you for your hard work and dedication for keeping the kingdom safe and healthy. And just know we couldn't do what we do in the field without the strong and dedicated nurses like y'all. So, happy Nurses Week. I'm excited. Go Chiefs, baby.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.